Colleagues, it's time to start our session. Good morning. My name is Lasha Gogwadze, representing International Federation of Red Cross, Red Crescent Societies. I would like to thank you all to find time to be with us this morning, and I feel privileged to moderate this event, together with honorable speakers, experts, to reflect on the global challenge which affects all of us, addressing drug challenges from health and humanitarian perspectives. Discover how the Rome Consensus tool can help achieve universal health coverage. In 2020, it was 3 years ago, the founders of Rome Consensus 2 launched the initiative and manifesto here during the CND. As for today, Rome Consensus 2 counts over 7,000 signatories from around 70 countries. It's a lot. Our collective intention is to promote, reinforce, influence drug policies where required to remove stigma, discrimination, criminalization of people who use drugs, and increase their access to essential services, including health. How can we make universal health coverage working for communities who use drugs? So without any additional wording from my side, I would like to give the floor to our first speaker, Dr. Massimo Bara, who is the founder of the Rome Consensus and the chairman of the Red Cross Red Crescent Partnership on Substance Abuse. Dr. Bara could not be with us in person, so he kindly shares his video greetings. Can we? So Massimo's, I think today, exactly this time, it's he's invited to be on the 50th anniversary of his services for Italian Red Cross, and then he tried his best to find the flight available to be back in Rome for midday, but he could not make it. So, but he sent us the video.
Thank you, Chair. The Rome Consensus was established in 2005 when the International Federation of Red Cross and Red Crescent, deeply concerned about the growing abuse of substances worldwide, decided that the drug issues should have been considered a health priority equal to other epidemics, emergencies, and disasters that need our intervention and support. 121 national societies defined a health-based approach that puts the individual and its universal right to care at the center by advocating and encouraging humanitarian programs to address drug pandemics to national and local governments. After that, we understood that the impact of our action to assist people with drug disorders needed a further step. We needed alliances in humanity to improve results. For this reason, in 2019, we updated our statement together with civil society, NGOs, professionals, activists, academics, and beneficiaries from all over the world who work every day in support of the people with drug disorders. It was a bottom-up initiative that started from our local communities that together built a common ground where everybody can feel represented, if its daily action is inspired by the light of science and humanity. We are open to realities which promote therapeutic programs at all levels, including those who involve the law enforcement that can divert and deflect people from punishment to treatment, as it was stressed in our previous side event on deflection. Considering that human brain is not particularly interested if the substances are legal or illegal, we don't take part in any political conflicts that involve prohibitionists and anti-prohibitionists. We are in favor of science and human well-being. The urgency to intervene in the field is moved by the fact that still today the vast majority of people with drug problems are discriminated against, marginalized, sometimes even tortured, and hindered in accessing social services and treatment. The primary objective of the humanitarian approach is to save lives, alleviate suffering, and preserve the dignity of persons. The goals of the Rome Consensus 2.0 Alliance are to explore and offer effective and evidence-based solutions to address drug problems, remove barriers to accessing treatment and harm reduction, meet and treat all people in need, especially the most marginalized, make sure that treatment offered are evidence-based and human, unify the voices of different stakeholders to build and dialogue between public authorities and civil society, promote humanitarian diplomacy to advocate for the health of people with drug disorders at all levels. Opening of our initiative has given good results. More than 7,000 people and 600 among NGOs, international organizations, clinics, universities signed the Rome Consensus so far. We received positive endorsement from UNODC, WHO, Pompidou Group, and now also governments are providing their support and closeness to our strategy. And this tells us that it is the right path and that we must continue to follow it together. Indeed, it is in the interest of all governments to meet and treat all people with drug disorders, to save lives and build safer communities. The more people you treat, the more you build a safer community. If you take people out of harm's way, you can decrease violence, conflicts, social tensions, and at the same time, you can fulfill the goal of universal health coverage without any discrimination and build more just and peaceful communities.
We thank Dr. Bara for powerful words. So the next speaker is also shared with us his pre-recorded statement. So His Excellency, Vice Minister of the Public Health and Services Provision of the Republic of Colombia, Jaime Rodriguez. So if we have video, so we can start.
Bueno, un saludo especial a la 66 periodo de sesiones de la Comisión de Estupefacientes de Naciones Unidas, en particular a los organizadores de este side event de la Federación Internacional de Sociedades de la Cruz Roja y la Media Luna Roja sobre el abuso de sustancias. A nombre del Gobierno de Colombia queremos presentar nuestro beneplácito con este proceso en la medida en que la propuesta del Consenso de Roma alrededor de la humanización, del enfoque de derechos humanos en la comprensión y manejo del consumo de sustancias psicoactivas coincide y está armonizado plenamente con la política pública de Colombia. En ese sentido, pues señalar, como lo saben ustedes, que Colombia ha padecido el flagelo de las drogas y en la medida en que ha tenido un rol en la producción y exportación siendo el primer productor de cocaína del mundo, que ha enfrentado bajo un mismo paradigma durante más de 35 o 40 años un enfoque, un esquema de guerra contra las drogas centrada en la criminalización permanente, pues ha llevado que en América Latina y en el mundo, sumando las víctimas de México y Colombia, hayamos acumulado la muy triste cifra de más de 1 millón de muertes de personas que han estado, digamos, como objeto de esta guerra contra las drogas. Y lo más grave, quizá, es que después de tanto tiempo, este tipo de guerra, este tipo de enfoque ha fracasado. El gobierno del presidente Gustavo Petro, denominado Colombia Potencia Mundial de la Vida, con todo el respaldo popular, viene haciendo un viraje sustancial para que se entienda el tema de las drogas bajo un enfoque de derechos humanos, bajo un enfoque de salud pública, bajo un enfoque no de erradicación o de lucha militar contra las drogas, sino de sustitución de tierras, de sustitución de economías, y en materia precisamente de consumo, efectivamente avanzar a un enfoque basado en derechos humanos y en salud pública, que tenga como uno de los ejes fundamentales la reducción de riesgos y daños. En esa tarea se encuentra el gobierno, que recién inició hace 7 meses. Estamos terminando de concretar una estrategia integral con estos enfoques para afrontar y enfrentar el tema desde la producción, la transformación, la comercialización y el consumo, de tal manera que dignifiquemos, de tal manera que estemos en armonía con la naturaleza, que al mismo tiempo, al hacer un esquema distinto de sustitución de economías ilegales, podamos también avanzar en la lucha contra el cambio climático y en la superación de la desigualdad, porque estamos convencidos que ahí está la base de que este tipo de producción, de transformación, se haya instalado en el país, en un momento en el cual también el presidente Gustavo Petro le ha propuesto al país y viene liderando cómo alcanzar una paz total. Si bien Colombia, que recibió el Premio Nobel de Paz hace algunos años, dio pasos sustanciales a través de acuerdos de paz con algunos de los actores del conflicto armado, tenemos todavía unos saldos muy importantes, y la tarea en este momento entonces es alcanzar la paz total, y un eje vertebrador ahí es, cambiando de paradigma, poder realmente impactar este tipo de economía que en la base lo que tiene que ver es con una combinación entre poder político, mafias y una concepción del desarrollo equivocada que ha llevado a injusticia climática, injusticia social. En materia de salud pública, el objetivo es que haya avances sustanciales hacia la regulación para que, por ejemplo, en Colombia pueda haber consumo adulto de cannabis, que al mismo tiempo podemos trabajar en una estrategia integral de promoción de la vida y de la salud para que las personas que consumen tengan todas las herramientas y el acceso a servicios promocionales y preventivos de salud. Y en el caso ya de las personas que tienen consumo o consumo problemático y adicción, podamos ofrecer alternativas de enfoques centradas, repito, en la salud pública, centradas en los derechos humanos y no en la criminalización de las personas. Para ello, por todo el país estamos desplegando un modelo de atención primaria en donde el componente de salud mental, el componente de aportar en la construcción de proyectos de vida autónomos de todas las personas en ejercicio de sus libertades, nos conduzcan a trasegar por un camino distinto, donde la promoción, la prevención, la dignificación del ser humano nos permitan enfocarnos en garantizar bienestar y entregar herramientas para la superación de los problemas de consumo. Muchas gracias a los organizadores, a todos los participantes de estas sesiones, y Colombia está también, convocando la cooperación internacional, la solidaridad internacional, para que a nivel global este enfoque tome una mayor presencia y que en el sector salud, a nivel de la Organización Mundial de la Salud y de todos los órganos de Naciones Unidas, podamos armonizar un ejercicio de política pública y de regulación que lleven a la garantía de derechos humanos y que abandonemos el camino equivocado de la guerra contra las drogas.
So I thank you very much, His Excellency Jaime Rodriguez. So now I have the privilege to give the floor to His Excellency Ambassador Alessandro Cortese from Italian Permanent Mission at the UN in Vienna. So your support and presence is very much valuable, and the floor is yours.
Thank you very much, Dr. Guguadze, and good morning, ladies and gentlemen, colleagues, and dear co-panelists. I'm very pleased indeed to attend this, for me at least, very important event. And I'm happy to be able to say that this event is co-sponsored by the Italian government. And I wish to thank the organizers for their great work and for the kind invitation, which is very much appreciated. Let me also thank the government of Colombia for supporting the event, and in particular, His Excellency, the Vice Minister of Public Health of Colombia, Dr. Urrego Rodriguez, for his inspiring words. Muchísimas gracias. At the outset, let me commend the passion, the enthusiasm, and the tireless efforts of the promoters and partners of the Rome Consensus 2.0, starting by my dear friend, Dr. Massimo Barra, who I would say brilliantly intervened online with his usual passion from online, since he has, as you said, a very important engagement in Rome today. Congratulations. We must recognize the many steps forward have been accomplished since the 2020 CND, where 3 years ago, Rome Consensus 2.0 was launched for the first time from this same Vienna Conference Center. But we have to acknowledge that there is still a lot to do for its implementation in order to respond to the needs of the most vulnerable people. Indeed, recent updates and the latest collected data, including the last UNODC and INCB reports, reflect a worldwide worsening of drug situation. The number of people who endangered their own physical and mental health by illegal use of drugs is increasingly worrying, especially among the youth. And the access to legal narcotics drugs for pain relief and other medical treatment is still extremely unequal. This, in my views, proves to all of us that old-fashioned legislations and policies based on criminalization and discrimination are not, at the end of the day, effective. Quite the opposite. We now should focus on the health and welfare of mankind. And with these words, I quote word by word the preambles of all the 3 drug control treaties. And this is possible only if we consider the fundamental principles of non-discrimination and mental health as priorities in the development of a humanitarian approach to drug-related disorders, and if we aim at building scientific, evidence-based strategies. This is very clear to the Rome Consensus 2.0 promoters, who indeed keep working and combating, if I may say so, on the front line. I sincerely share and support the basis of the humanitarian policy framework of the Rome Consensus 2.0 declaration, namely the need for a more humane attitude in support of people with drug disorders while fighting their stigmatization. A health-centered approach aimed at maximizing human health is crucial in Italy, as much as in the rest of the world. And as a matter of fact, and now I limit my analysis to my own country, Italian drug policies ensure access to treatment provided by the public service through a multidisciplinary approach. In Italy, we have hundreds, I was told more than 700 drug dependence units, care and treatment centers, and therapeutic communities that provide free care to drug users and giving them the motivation and the strength to improve enormously the quality of their lives and ensuring to them practical help towards social reintegration, which is, at the end of the day, one of our main targets. Finally, I am absolutely convinced that governments, international organizations, civil society, and I would say all of us, as responsible citizens, should be working all together for this complex, but in my views, essential endeavor of treating people who use drugs with empathy and support. This will bring us a step forward following the Rome Consensus 2.0 towards a more humanitarian drug policy and ultimately towards a greater social peace and prosperity. Thank you.
Many thanks, Your Excellency. Indeed, we need to work together. The road is not easy, but there is the hope and there is the light, and it's achievable. So now I have the pleasure to give the floor to Giovanna Cambello, the Chief of UNODC Prevention, Treatment and Rehabilitation Section, supporter, friend of Rome Consensus, and all of us. The floor is yours.
Thank you, Lascia, Excellency, and dear distinguished co-panelists and dear friends and colleagues. I want to use the next 5 minutes, and Romina will help me to highlight, and I'm sure that I will be going too fast because the Rome Consensus is such a rich document. But what I want to highlight is how the Rome Consensus is a useful tool to advocate the implementation of international drug policy commitments. There are amazing policy commitments that have been included in our in the work of our member states, and that are covered very strongly by the Rome Consensus. And my thesis here is that you can use the Rome Consensus to take member states to task and to say, you committed to this, use it and do it. And I want to highlight some of the respects in which there is this amazing coincidence of intents. I will not manage to do it all, but I think you will get the gist, I hope. And I hope you will be able to see why at UNODC, this is a civil society tool. But for me, as an observer, I've always been at the back and cheering you on, because I think that our intent coincide. Next slide. Well, this is what I just said, so we can go on to the next slide. Next. As you can see, I tend to create too many slides, but I'm bringing this by putting the right to health of people at the center. This is at the center of our commitments, and is very much at the center of the Rome Consensus. And for example, one side where both the commitments and the Rome Consensus come out very strongly is the right to health of people who need access to controlled medicines. We know that it was originally why the drug control system was created, to give access to people who need controlled medicines while preventing diversion and non-medical use because of the dangers. And we know, next, yes, that unfortunately this is not the reality, and that more than 80% of people worldwide do not have access to controlled medicines, especially for the management of pain. These are data from our World Drug Report, and for me, it's again a very strong point that I would like, where we at UNODC should join forces with civil society and member states to change this situation. Next. A balance is possible. We are working, you are working, and let us use the Rome Consensus to advocate for ensuring access while preventing diversion and non-medical use. Next. Another point that comes out very strongly in the Rome Consensus is the right to health of people vulnerable to starting to use drugs, and it is a point that was alluded to by His Excellency as well. And the Rome Consensus calls for evidence-based and balanced prevention, and I think we all should do more to invest in this field. Next. And I would like to stop on this slide for 1 second, because we know that the starting of using drugs is linked to a complex set of vulnerabilities, many of them linked to inequalities. And while evidence-based prevention is not a solution to inequality, I would like to state that we know that it has been proven to be effective in supporting the healthy and safe development of children and youth, also in very difficult and marginalized circumstances. And I would call everybody who believes in the Rome Consensus and in the commitments of the member states to strengthen our activities and our investment in this field. Skip all of the slides until the next section. I wish I could, I can talk about this forever, and I will use my next minute to highlight something that has been already mentioned by other colleagues, and that's why I left it at the end. It's the right to health of people who use drugs and people with drug use disorder. In fact, this is maybe the thematic area where the Rome Consensus has the set of strongest recommendations. We have heard already from Dr. Barra, and we will hear also from some colleagues. And I would invite you all to make great use of the Rome Consensus to promote many things, but I will focus on 2. Now I need to find the right slide. Next. No, that one, the one before. There is too many human rights violations that are still undertaken in the name of treatment and care. We have excellent tools that have been recognized by the member states, including the international standards that we have published with WHO. Let us use them to change this and make sure that services are based on evidence, are not discriminatory, are not stigmatizing, and are actually there to be take care of the health and well-being of the people who use drugs and people with drug use disorder. I would call in an old-fashioned way patient-centered care, but in this field we need to be stronger. Next. You see how much I could have talked. Stop. And the second one is to work as much as possible to expand alternatives to conviction or punishment for any case that is appropriate and of a minor nature. We have the mandates. We can do it. We know it is more effective. We know it's more cost effective. We know it's good for the health of people and for the community. And let us join forces to change the situation. And for the minority, the small minority of people that will need to be in prison, let us expand the services in prison, because the situation is extremely serious there. I think go until the end, and not the very, go. This one, no, the one before. I just wanted to say, well, thank you for the opportunity. And I hope that I'm always very happy to be here and join forces and join my voice to the voice of the Rome Consensus. What I hope we manage to do, especially now that the pandemic is a bit behind us, is to make this a reality also in the field. Thank you.
Thank you, Giovanna. And so we would like to have your presentation in full. So, and I think this is possible. And also, sure. And we will follow up all everyone's interventions, as the session will be recorded, and the recording will be available on the Rome Consensus website. So if you have any urgency to have the recording, so you can send the message to info@romeconsensus.com, and then so we will provide, and maybe in a few days the recording will be there. Yes. maybe can we write somewhere the address or okay. So now I have the pleasure to invite you, Joanna, Joanna Travis Roberts, the Chief Executive of the International Society of the Substance Use Prevention and Treatment Professionals. Very curious to hear more from your organization.
Thank you very much. And thank you for the introduction and the opportunity to speak on this panel this morning. It's good to see you all. As Lasha said, I am the Chief Executive of the International Society of Substance Use Professionals. And we are an organization that's really aiming to bring together and represent that community, the workforce, the people that are on the ground. I do have a presentation whenever that pops up, just to so that you don't have to listen too hard to all of the words. But as an organization, our vision is to create connected, trained, knowledgeable and effective international network of substance use prevention, treatment and recovery support professionals. And what we want them to be doing is the key part, undertaking and promoting high quality, evidence-based and ethical interventions in their day-to-day work, whether that be practice, research, policy, etc. And it reflects exactly what Giovanna has just taken us through, the evidence, disseminating the tools that are there, advocating for the things that we know work, and keep reflecting that message that is the, you know, the message of our members as well. Do you want to go forward a slide, please? That science and human well-being is at the center of this work, and that we do have the tools, the knowledge, the connections, the support to be able to be undertaking it. Next slide, please. As an organization, we are funded by the US State Department, and we sort of came into existence by this group of organizations whose logos are on the screen, saying, okay, there's lots of things happening around the world. We need some place to bring it all together, to help people connect with each other, and, you know, to be that central reference point for this evidence that we're talking about. And they sort of called themselves the Coherence and Collaboration Group, and we grew out of that. Next slide, please. We have almost 30,000 members around the world. It is spread. Some areas are not so represented at the moment. We're trying to expand slowly. We were registered in 2016, so it's a gradual process. But we've seen a real uptake in recent years of people wanting to become members, people really considering themselves as part of this community. And in the last presentation, interestingly, we're seeing it expand. So recently we've had a real growth in the people that come and join ISUP from the law enforcement sector, for example. So people are starting to see that this workforce, it's not the people that go to work every day thinking, oh yes, I work in prevention, I work in treatment, you know, I'm going to go to my recovery support role. But it's many people are doing this, that is not their main job, and ensuring that we're all, you know, supporting this full spectrum of the workforce is really important. Next slide, please. Oh, sorry, I should have had that slide while I was saying that about spectrum. And then next slide, please. I just wanted to say thank you to those of you in the room that are working in this field, representing the workforce from your country, endeavoring to support and enable them with connections such as the Rome Consensus. You know, thank you for supporting those people on the ground that are really trying to do that work. And thank you to those of you that are doing it. You can skip 2 slides. Just to, and again, please, thank you. Just to also point out that we do not sit alone. And I think that's a real strong thing that I feel as well from the Rome Consensus, that we work within many partnerships. We try and connect people to the resources that are out there from many other organizations. And this idea of professionalizing and supporting the workforce is not done by us alone. We connect people to things that are out there from a range of organizations. And these organizations on your screen, ICUDDR, GCCC and ITTC, we're all taking different parts of this workforce support puzzle. Next slide, please. So how do I go about doing my day-to-day work of engaging and building this community? We have an online presence because we are global. We have national chapters that are host organizations in a country that are delivering the mission within their local context. And we have 35 of those around the world. And we have events. So we run conferences and we have online events. So just trying to keep the knowledge flowing and the connections with the messages going. Next slide, please. I talked about the fact that we have these offices around the world. Thank you. Next slide, please. And this is where we're spread. So, it's an ever growing concept, and we look forward to, connecting with those of you within these countries, but also building new relationships and building further stronger connections as our countries grow. Next slide, please. So to bring it back to the sort of crossover with the Rome Consensus, what do we hear from our community? In the same way, the same message, they are also working tirelessly to save lives, alleviate suffering, maintain human dignity. So any ways we can enable, support, and enhance that, we're trying to do. They're trying to reduce stigmatization, which honestly, I hear daily as an issue for our workforce. And I think, that is a shared concern. And just, as a byproduct, we're starting a series of webinars on stigma from different perspectives around the world on March the 20th, trying to do our part, but it's a tiny drop in the ocean. They are working to engage marginalized communities as well, and, to be able to do the work that they're trying to do to bring people in. And just to say, remember that concept of coherence and collaboration that we were born from, it is a shared mission, that we are about endorsing those principles, and we welcome the approach of the Rome Consensus to grow that network, really advocating for and implementing this concept of universal health coverage, which, next slide, just as a last thing to remind us that, it's so easy. This is such a concept that I think everyone can understand and engage, and that this is what our workforce are really, want to be able to give those full range of quality health services that they really want to be in a position to give. Next slide. So that's it from me. I thank you again for listening. Please, get in touch, join ISEP, encourage your communities to join ISEP, it's free. And I look forward to hearing more from you. Thank you.
Thank you very much. Very interesting. Yes, you are not alone, and I feel that we are not alone. Also, we have additional brilliant group of colleagues that can work with the Rome Consensus members, as well as the Red Crescent societies in the listed countries that you mentioned. So our next speaker is Martín Díaz, co-founder of Nomad Institute, European Institute of Multidisciplinary Studies on Human Rights and Science. Martín, floor is yours, and thanks for your help for all organizing this event.
Thank you, Dr. Lasha. Thank you, everyone. Greetings, dear colleagues and brothers and sisters all. I am honored to address you today as an enthusiast of Rome Consensus, and to the other hand, as a forcibly displaced person due to the destructive consequence of the war on drugs. As we gather here today, millions of people around the world continue to suffer from punitive measures and criminalization policies that have led to the marginalization of vulnerable communities. I take this opportunity to highlight the progress of Rome Consensus 2.0 in the consolidation as a fundamental tool for an effective and humanitarian drug policy reform. This manifesto, supported by a large number of organizations and world leaders, advocates for a drug policy which is based on human rights, public health, and social justice. We must acknowledge that the current punitive model has only strengthened the structures of death that must be stopped in the name of peace and dignity. Over the years, it has become evident that the so-called war on drugs has turned out to be a cruel war among people against people. It also has prevented an effective model and generated exorbitant profits for criminal organizations that terrorize entire communities and countries. This model has clearly become a disaster for the rule of law. In addition, it is even reality that all this devastation has not stopped the abuse of drugs, but quite the opposite, legitimizing fallacies and profound contradictions, while stigmatization and criminalization make the lives of people who use drugs more dangerous and unhealthy. Remember, more than 500,000 of people die each year for overdose or adulteration, and this rate continues to rise. It is urgent to address this problem from a public health perspective, ensuring access to professional health services and comprehensive education based on science. We need to eliminate prejudice and stereotypes that stigmatize people who use drugs. Harm reduction strategies are crucial to prevent overdose, improve public health outcomes, increase safety, and restore the trust in the laws enforcement. The community must be involved to connect people with appropriate care and resources, contributing directly with the Sustainable Development Goals, specifically 3, 10, 16, and 17. I express my sincere appreciation to the government of Colombia, which has shown its commitment to humanitarian drug policy reform. We hope to have President Gustavo Petro's endorsement soon, which is a powerful and symbolic act for other heads of states to join these humanitarian efforts. And also I want to thank the ambassador of El Salvador to stay here, hoping you can bring this message of humanitarian intervention to our country. Dear colleagues, it's clear that we are running out of time to find a solution to a problem that is more than just urgent. Millions of people worldwide continue to suffer from violence, discrimination, marginalization due to the current necropolitical model. It's essential to work together to restore the dignity and rights of all those affected people for this policy. It is important to hear proposal of Rome Consensus 2.0 regarding paradigm shift in drug policy based on respect for human rights, harm reduction, public health, and social justice. I would like to call all on here present, especially public authorities and members of civil society, to support and join the Rome Consensus and work towards build a more equitable and healthy world. We need to act together to create a better future where peace and dignity prevail. Thank you.
Thank you very much for empowering us and keeping our session at the level it should be. So our, I would not like to say last speaker, so next speaker, Executive Director of MENARA, and we all know the achievements of your institution, the Middle East and North American Harm Reduction Association. North African, sorry.
Oops. It's a small difference.
A few miles.
My apologies. So maybe it's maybe there is now the possibility for the cross-continental collaborations. Floor is yours.
Okay. Good morning, everybody. Mr. Chair, Excellencies, distinguished panelists, dear participants. First, I would like to thank Dr. Massimo, Romina, and the team for considering MENARA as part of the consensus, Rome Consensus 2. I'm glad here to be with you to talk about, in my capacity as director of MENARA, but also to give you a kind of insight overview on the situation in the MENA region. We live in a region where we have the highest number of displaced people. If you remember also, we have the war in Syria, the war in Yemen, here and there, Afghanistan, Iran, etc., Saudi Arabia, and of course, the Beirut blast 2 years ago, 2 years and a half maybe, where the third of the capital Beirut were destroyed, people were displaced, injured, and killed. We have an increased prevalence of HIV in the MENA region. We have a low coverage of ARV, antiretroviral, the lowest in the world maybe. We live in countries where repressive laws are ruling the countries with a death penalty in some of them. This prevents key populations, people who use drugs, and people living with HIV to seek services. We have only 7 countries who have opioid substitution therapy. We have only 9 countries who have needle and syringe program, and yet we can talk about the coverage. No needle and syringe program in the prisons, very weak services in the prisons, health services, I mean. No drug consumption rooms, no naloxone at the community levels. And you can imagine the overdose and death by overdose. Needle and syringe program is very weak. We have a recent assessment that showed that we distribute 25 syringes per year per people who inject drugs, while WHO recommendation is 2 to 3 per day. The MENA region for the donors is considered as a rich countries, as a rich region. Yes, we have rich countries, but yet rich countries doesn't mean rich population. Rich countries means rich governments, rich countries means rich families, tribal, etc., but not rich population. And that's why I think there is somehow a need to reconsider the position of the donors, namely also the Global Fund as well. For I don't know what reason, we don't have any specific service for women in our region. Women in the region are being left behind. And whenever a woman go to seek a services, she is somehow subject to be abused. In all of this darkness, we still have some lights. Okay, we have a strong and civil society organizations. We have now a regional coalition of the regional networks working on HIV. We have community-led organizations, namely MENA Network of People Who Use Drugs, MENANPOD, and MENA Rosa for women who living with HIV. I can talk also about some other implementations that happened in some countries. For example, in Egypt lately, they introduced harm reduction services in their services. MENARA was called to support them in capacity building for the healthcare providers, and very soon we will talk about the long-acting buprenorphine and conduct some studies on the effect of stimulant and on the increase of hepatitis in the country. So there are some activities, but the issue is that these activities are not under a strategy. It's not a strategic, it's like doing here and there without having a real strategy for the region, I mean. And we are now facing some challenges. One, we are facing the risk of the withdrawal of the Global Fund grants. We don't know if we will have another grant for the civil society after 2024. In June, the UNAIDS regional support team will be closed. So there will not be a MENA region for UNAIDS, and the region will be divided in 3 sub-regions. No voice of the civil society organizations at from the MENA region at the international fora. We don't exist neither in the PCB nor in other forum. So that's why, and this is my message for you, an urgent action is needed to support sustaining and scaling up the services in this region. As we are dealing with a human being, people who have the right to live in dignity, we are dealing with citizens who have the right for quality life and to access to health services. Thank you. Sabati.
Thank you very much, Eli. So Eli was our last speaker. So we are a bit out of time.
Next or last?
Last speaker, next last speaker, and also I extended your partnership. Huh? So, network.
Yeah.
So I think this will be great. So, but we have time for a couple of questions if you have time, because I know that we are a bit out of normal agenda. So, or maybe we have some questions from the colleagues online. Jesse, Romina, if we can check. If not, if there are any questions and any comments or any additional points to the speakers. So, yeah. So great, it seems everything is clear, we are on the same line. So this is really the right time. I mean, because Giovanna, Your Excellency, you mentioned the access to health, right to health, universal health coverage. 2023 is the key year. So we know that during the UN General Assembly in September, the second UN high-level event on universal health coverage is taking place. So we need to make sure that universal health coverage works for the communities who use drugs, people who use drugs, and that those people are not left behind. So yes, but this will not happen unless we are vocal, visible, strong, consistent, and knowledgeable in our asks. When we say we, I mean, of course, together, all of us, together with communities, because as we all say, it's their rights, it's our rights, and I never want to distinct myself from anyone else, but it doesn't mean that road is easy, as you mentioned, so, and it's short, so it's the long way, but we hope. So I would like to thank you very much for your attention and time. If you have any questions and if you would like to know more about Rome Consensus, we have the room M018 booked for another hour where you can meet the members of the Rome Consensus. Yeah, and the last thing, so in May, there is a plan to organize the Rome Consensus 2 Summit, and all details you can find on the Rome Consensus website. I would like to thank you very much once more for all supporters to the event, your missions of Italy, Colombia, all the co-founders and the partners. Have a fruitful day today, and thank you very much. Very much. Thanks.